Have you ever stopped to think about how insanely precise modern dentistry has gotten? I mean, we're talking about replacing a tooth with a dental implant that has to be placed perfectly, down to fractions of a millimeter. Well, today we're going to pull back the curtain on the technology that's making it all possible, creating what's basically a digital blueprint for a perfect smile.
Right, let's just think about this for a second. It's a massive challenge, isn't it? A surgeon is working in this tiny, really sensitive space. If they're off by just a single millimeter, it could mess up the result, or, even worse, hit a nerve. So, how in the world do they get it right every single time?
You know, the answer isn't just about having a steady hand. It's about having a much, much better map. And that map is created through computer-guided implantology. Before a surgeon even picks up a tool, they create this exact digital copy of the patient's jaw. You can see it right here. It lets them place the implants virtually, planning the perfect angle and depth, and making sure they steer clear of any important stuff, all on a computer.
To really get why this new way is such a game changer, we have to appreciate the problem they're solving. Let's call it the millimeter challenge. Because in this field, getting it close isn't good enough. Precision is everything.
This analogy just nails it. Doing implant surgery the old-fashioned freehand way is like trying to build a ship in a bottle in the dark. Surgeons have their experience, sure, and they've got flat 2D x-rays, but they can't really see the full three-dimensional landscape of the bone. And that leaves room for tiny errors that can lead to not-so-tiny problems.
So, this is where the revolution starts. It's not in the operating room, it's on a computer screen. This is where that digital blueprint for the perfect surgery is drawn up with incredible detail.
And right at the heart of this digital process is software called AxisGuide. Think of it as an all-in-one digital workshop for imaging, planning, and something called CAD/CAM, which is just a fancy way of saying computer-aided design and manufacturing. What's really cool is that it was designed with dental professionals for dental professionals, so it's super intuitive.
So how does it actually work? Well, it all starts with data. First, they get a CT scan, which gives them a beautiful 3D picture of the bone. Then they take a surface scan. That's the STL file, which maps out the exact shape of your teeth and gums. And then the AxisGuide software does its thing, merging those two worlds into one super detailed, interactive 3D model.
And this is where the magic happens. On the left, you see all that raw, complicated scan data. Then, the software turns it into the clean, actionable plan you see on the right. It's literally a color-coded roadmap showing the exact spot, the perfect angle, and the precise depth for every single implant, all while safely avoiding nerves and sinuses. It's a full-on digital rehearsal of the surgery.
Okay, a perfect digital plan is one thing. But how do you get that perfection from the computer screen into the patient's mouth? Well, the solution is a truly brilliant piece of physical engineering.
You do it with this, a custom 3D printed surgical guide. The best way to think of it is as a high-tech stencil. It's printed directly from that digital plan we just saw, so it fits perfectly over the patient's teeth. And those little metal cylinders? Those are the secret sauce. They're precision channels that guide the surgeon's drill to the exact spot at the exact angle every single time. No guesswork. And here's something that's absolutely crucial for doctors. This whole system is flexible. It's not locked down. The surgical guide can be designed to work with pretty much any brand of implant the surgeon already knows and trusts. This is a huge deal because it means they can adopt this amazing precision technology without having to throw out all their preferred tools.
Now this is where it gets really interesting. Not every case and not every surgeon needs the same level of handholding. So AxisGuide offers two different options, basically two different philosophies for hitting that perfect placement.
First up, we've got the Unidrill Guide. This option is perfect for the surgeon who is confident in their own drilling technique, but just wants a perfect, can't-miss-it starting point. It's all about providing that critical initial guidance to get the angle and position just right.
So what the Unidrill Guide does is it uses a single, small pilot drill to create the initial path. It sets the perfect point of entry into the bone, the exact angle, and the starting depth. And from there, the surgeon just takes over with their own familiar kit to finish the job. It's this great blend of digital precision up front and the surgeon's trusted expertise.
The second path is the multi-drill guide. And you can probably tell just by looking at it, this is a whole different animal. This is the fully comprehensive system. This guide doesn't just start the process, it guides the entire drilling sequence, from the very first drill bit to the last.
So here's a quick side-by-side to make it super clear. Unidrill on the left gives you that perfect start, and then the surgeon uses their own tools. Multi-drill, on the right, is a fully guided procedure, also known as an osteotomy, that uses a special, dedicated kit to guide every single drill, one after the other, to create the final space. It's two different approaches to the same goal: perfection.
And this is the comprehensive kit that goes with the multi-drill system. As you can see, it has absolutely everything needed for that fully guided surgery. It's got drills and guides for 5 different diameters, which means it can handle a huge range of implant sizes. It's a complete all-in-one solution for total end-to-end precision.
All right, so we've seen the software and we've seen the guides. How does this all actually come together for a dentist in their day-to-day practice? Well, the workflow is actually incredibly simple and efficient.
It boils down to just 4 steps. The clinician uploads the patient's scans. Then, and get this, in less than 24 hours, they get a detailed treatment plan sent back. They hop into the AxisGuide software, review it, make any tweaks they want, and approve it. Once they give the thumbs up, the physical 3D printed guide is made and shipped out. It is fast, it's secure, and it's so efficient.
And the system is smart. It adapts to the situation. For a patient who's just missing a few teeth, the standard scans are all you need. But what about for patients with no teeth at all? For them, there's a clever trick called the double CT scan protocol. Basically, they scan a model of the patient's future dentures to make sure the digital plan lines up perfectly with the final smile they want. It ensures both function and aesthetics are spot on.
So when you bring all of this together, the brilliant software, the 3D printing, the super efficient workflow, what does it all actually mean for the patient? What's the real impact on the future of your smile?
It really comes down to these 4 things. First, you get incredible precision because all the guesswork is just gone. That leads directly to safety. The risk of complications plummets. It's also way more efficient, which often means shorter surgery times. And maybe most important of all for you, the patient, it delivers predictability. That means better, more reliable results, and a smile you can be truly confident in. And that kind of leaves us with a final, bigger thought. We've seen how this is transforming dentistry, but just imagine for a moment. What does the future of medicine look like when every surgical procedure, from the most routine to the most complex, can be planned, rehearsed, and absolutely perfected in a digital world before anyone even makes a single cut? The possibilities are just incredible to think about.